Begin tonight here in Nairobi, where Citizen TV has been granted rare access into the Mbagathi Hospital COVID-19 Isolation Center. The center is currently the main treatment facility for patients with mild to moderate symptoms. The hospital is also the first port of call for persons suspected of having the new coronavirus. Our special projects editor, Asha Mwilu, has just left the facility a few hours ago and now joins us live. Now, out of caution, she will be working away from the office for the next several days, just to put that out there. Asha, thank you so much for joining us. Asha, let's begin with your experience gaining access to this very controlled and sensitive environment. One would imagine that they have a very strict access protocol. So what is the exact procedure before one enters this particular facility?
Thank you, Lillian. As you can imagine, it's been 1 month and 4 days since Kenya reported the first coronavirus case. And we've been trying to gain access to these facilities, to Mbagathi Ward and Kenyatta National Hospital, mainly to just see how our healthcare workers are coping with the situation. And finally, we've been granted access to Mbagathi Hospital. That was, of course, ground zero for Kenya. It's a very surreal experience. It's the reality for quite a number of Kenyans who are trying to recover from COVID-19. It's also a reality for healthcare workers who have to go there and treat these patients, our doctors and nurses. You have to be very careful when you go in there. One of the reasons why government has allowed us to access these facilities is first and foremost to show us how they are handling the situation, and to also allow us to get a chance to interact with some of the patients there. At Mbagathi Hospital, which has a capacity of around 60 patients, they are handling very moderate, mild to moderate, patients with mild to moderate symptoms. And we got to speak to some of them. About half a dozen men, we got access to them. What we noticed is that they're actually very in high spirits. They don't seem to have very, very severe symptoms. People are on their phone, they're able to work on their laptop, but they have tested positive for the virus, and they have to stay at that facility for a couple of days until they test negative twice, then they're allowed to leave. So to get access to such a facility, of course, we had to be in full protective kit together with the healthcare workers that you're seeing in our footage. And we had to take precaution. We had to go with minimal equipment. And it's just for us, that risk was important to take at this stage, because there are very many questions that Kenyans are asking. People are asking, what do our facilities look like? How many ICU beds do we have? How many ventilators do we have? And we felt that it was crucial at this point to go and document that for our audience members. Lillian.
So, Asha, if, you speak about the patients there not having very serious symptoms. Paint for us a picture of what it looks like inside the facility. We know this is the main treatment center for COVID-19. So what exactly does it look like in there? We're able to see some images on our screens, but exactly how does this particular center look like?
It's a two-story building. The gates, first and foremost, are locked from outside, and this is obviously to control movement in and out of that center. And the people who are allowed in are very minimal. Only healthcare workers, doctors, nurses, the cleaners, people who are going to give the patients food. And what we notice is that there are hallways. Patients are allowed to interact with one another. We got access actually to two facilities. So one is the infectious disease unit at Kenyatta National Hospital, the main hospital. And the second one is Mbagathi, the isolation unit at Mbagathi Hospital. So at Kenyatta National Hospital, patients do have individual beds with their own separate bathroom facilities. And that specific hospital can only hold around 7 patients. At Mbagathi, which has a capacity of 60, people are able to interact freely. It's more of a shared ward. And from what we saw, patients are allowed to walk around. They're allowed to interact with one another. They've sort of created like a support system for one another, some form of like a small family. we did notice that there were some patients with a bit more moderate, going towards severe symptoms. And for those patients, of course, we allowed them a lot more privacy. We allowed the doctors to see them more privately, and we were able to interact with some of the other patients. We did not see anyone on a ventilator here. There was no one in an ICU unit. So for most of these patients, they can move around. They're healthy enough to do their daily activities, Lillian.
We wind up, Asha, on the health workers, how they're keeping themselves safe. I know you've touched briefly on that, but how exactly they're keeping themselves safe, and whether doctors have any special advice for someone such as you who has been to this very risky environment, this particular facility. Let's begin with how the health workers there are keeping themselves safe, and then go on to what doctors are advising persons such as you, and of course other people who might have been there for certain reasons, on how to keep themselves safe.
Lillian, that's actually really crucial, and that's one of the reasons why we wanted to access these facilities. Our healthcare workers, first and foremost, must always have a fresh pair of personal protective equipment, which is what you're seeing there. We were donning some of the PPE with them, and they have, every single time that they go in to see a patient, they must put on a fresh set of that PPE. So that's one way they have to protect themselves, because as you know, COVID-19 is passed on from one person to another through droplets. And inside Mbagathi, because patients have their, they have their belongings all over, all surfaces are deemed to be contaminated in that area. So you must first and foremost make sure that you don that kit in the right way. And then when you leave the facility, you must then remove, which they call doffing. You must remove that kit in the correct way. Otherwise, you stand a risk of contaminating yourself. So the PPE kit is very crucial. Government now must make sure that health workers have these kits throughout this pandemic. And the other issue for health workers is, where do they go after they've been to the hospital? We know that government said that they're going to set aside a facility for them, so accommodation where after they leave the hospital they can go and self-isolate, because you have to keep distance from the general public, and you also have to keep distance from your family. So a lot of these health workers now want to see how that will be implemented, because the safety of their families is also on their minds. For people like us who have been able to get into those facilities, as you've seen, I'm working from home. The advice for us is that we, just as the health workers, we are now considered people who've been on the front line. So we have to keep distance from the general public. That means I have to protect my colleagues at work. I have to protect my family members. And that means I have to, walk away from everyone else. And, we've taken all safety precautions, and hopefully we will be okay.
Mm-hmm. Many thanks for that, Asha. As earlier mentioned, this is a Citizen TV exclusive. Citizen TV was granted rare access into the Mbagathi Hospital COVID-19 Isolation Center. Asha Mwilu there speaking to us just a few hours after leaving that particular center, and she will be filing a detailed report tomorrow on the goings-ons there, and indeed just how they are dealing with this particular pandemic as we speak. That is Asha Mwilu giving us a report on what exactly goes on inside the Mbagathi Hospital, that is at the COVID-19 Isolation Center.